the Medical AI Podcast.
Hello, I'm Dr. Felix Beacher, and this is the Medical AI Podcast, a 30-minute thrill ride of big ideas. We talk to a range of top guests, from industry innovators to scientists to philosophers. This is brought to you by Omdia and Informatech, where I'm the head of healthcare technology. Today we are going to be discussing an interesting new research study on the important topic of attitudes to medical AI within medical imaging professionals. There's a paradox at the heart of medical AI. The technology is ready, it's already there, but deployment is still rare in clinical practice. So I often ask, what are the blockages? And one major blockage could be attitudes to it within medical imaging professionals, and that's what our new study explores. To discuss this, I am joined by Hazel Edwards. She is the professional officer at the British Medical Ultrasound Society, or BMUS. She is a clinical sonographer by background, a lecturer at King's College London, and the East of England Imaging Academy, and former editor-in-chief of the journal Ultrasound. And that's only a few of the things that she does. So my first question is, Hazel, where do you get the time? Do you ever get time to sleep?
Well, I just think I've been so lucky over the years. I've had so many opportunities to get involved with other organisations, all connected with ultrasound and radiography. And now I've got this job with the British Medical Ultrasound Society. It doesn't even feel like work. No 2 days are the same. So I really don't mind that I don't get that much free time. I just enjoy my work.
Excellent. Well, a very warm welcome. It's a pleasure to have you on. So let me start by describing this study that you and I collaborated on for the listeners. This was, as I said, a collaboration between BMUS and Omdia, and also Omnia Health, on AI acceptance within medical imaging professionals. Matt Brady from Omnia Health also provided invaluable support. Now, AI acceptance within medical imaging professionals is a big gap in the literature, and it's an important one. We got complete data on around 100 medical imaging professionals. We measured a range of attitudes on medical AI, including positive statements such as medical AI could reduce medical costs, that it could lead to more accurate diagnoses, and that it could speed up workflows. And we also tested negative statements like, for example, that it involves ethical problems, that it could replace my job within 3 to 5 years, and that it could lead to more clinical mistakes. First question was, have you used medical imaging AI? Now, the results were not sure, 20%, which I think is an interesting result in itself. Yes, 28%, and no, 52%. That's more or less what I would have expected, I think. But what would you have expected, Hazel?
I would have expected probably the not sure group to be even larger. At the moment, we've got 1 in 5 who say they're not even quite sure whether they have been involved with using artificial intelligence in medical imaging. And I'm surprised it isn't higher in a way, because with the end users, with people like radiologists and radiographers using equipment, it doesn't necessarily mean that we know all that's going on inside the equipment and with the software that you can bolt on and that kind of thing. Right. So I'd expect more to be said, oh, I don't know really, I might have, and I'm not sure. A bit like if you were to ask me about certain gadgets on my car, I probably wouldn't even be able to tell you if I have those things on my car, but that doesn't mean to say that I don't know how to drive it well and look after it well. So yeah, that's the surprise. But no, I'm not surprised that over half still don't think they have used artificial imaging in their work.
And so can we talk about you, Hazel? Have you yourself used medical imaging AI? And if so, what type, what for?
Well, there again, I would say that I am fully aware that I've used it once for one application. But again, I wouldn't know if I've used it since. But certainly, probably about 10 years ago, we were using it at the trust I worked at the time when we were measuring the nuchal thickness at the back of babies' necks in utero. So during an obstetric scan, when the baby is round about 12 weeks old, you will measure a little bit at the back of the baby's neck to judge how thick it is, and then they go into another a screening program connected with detecting Down syndrome. And this measurement is tiny; it's to 1/10 of a millimetre, so it's quite difficult to get your eye in. And there were automatic caliper placement opportunities that we were expected to use. In other words, we would get the best view of the back of the baby's neck and then push a button, and these automatic measurement crossers would go on the area in question.
Yeah.
And I thought that was really neat, actually. I felt it took a lot of the pressure off me trying to get the calipers in the right place. The machine did it for me. So happy days.
I see. Okay, so according to our survey then, the most common type of medical imaging AI used was for image cleaning. Is that something that is used in ultrasound very much? Because obviously in ultrasound is different from other imaging modalities, right? Because you can get an image which a layman would think is kind of messy.
Yeah, certainly ultrasound by its very nature is absolutely full of artifacts. In other words, things that are on the image that are not really there, and things that degrade the image quality. Too much noise, certain shadows and speckle. And so certainly I think all good quality ultrasound machines have automatic processors inside them that will clean up the image for you, get rid of as many of those artifacts as possible. So yes, that's common practice, but I find it hard to distinguish between artificial intelligence and software within, computer software to improve things. It's a fine line for me. With the image cleaning, we as the users, we as the sonographers and radiographers can adjust the cleaning opportunities. So a bit like on your television, you can increase the brightness, you can change the colour combination. So whether that's the image cleaning that we're talking about in this particular survey, I couldn't say for sure.
Yeah. Okay, all right. Well, let's go on to the attitudes, which is, I think, in a way, the really core results of the study. Overall, we had, I would say, a fairly positive, an indication of positive attitudes. And what I mean by that is that we had overall positive attitudes in, let's see, 6 cases, but negative attitudes only in 2 cases of statements. So let's look at the really core ones in particular. So one of the positive statements was that medical imaging AI could speed up workflows. Another one was could lead to more accurate diagnoses. And another one was could reduce medical costs. So to me, this is a very, very important result. And what it suggests is that radiographers and radiologists are, in general, fairly receptive to the idea, at least, of medical imaging AI. Do you want to talk about that a bit, Hazel?
Yeah, and this doesn't surprise me at all, actually, because I think radiologists and radiographers, including sonographers, are very science-based. They are very flexible and adaptable and welcome new technology. I mean, within medical imaging, it is a really fast-moving area of medicine, and we've shown consistently over the decades that we just embrace everything as it comes along, whether it's MRI or PET-CT or new gadgets on ultrasound, new data storage facilities. We just do our best to embrace it. So the fact that the overall comments are positive is what I would expect. And I also find it very interesting that radiologists and radiographers are saying that they anticipate that artificial intelligence will speed up workflows. And it's very time consuming for humans to look at lots and lots of images and interpret and analyse and produce reports. So if AI could take some of the spade work related to that from us, that would be amazing. But one thing I do wonder with this result is with whether AI can speed up workflows, and it's anticipated they will. Is it because radiographers and radiologists are anticipating that it will, or is it because they really hope it will? Because our biggest mountain to climb now in the post-COVID era is the backlog of tests. We had a big problem within radiology keeping up with demand before COVID, and COVID has simply exacerbated the situation. So now we've got this tsunami of patients waiting for tests, and I'm just wondering if it's almost wishful thinking on the part of your respondents, like they hope to goodness it will speed up workflows, and hopefully it will too.
I'm just imagining a tsunami of patients and what that might look like.
Yes. Well, it is a reality. Yes.
So there's an interesting conjunction between this question on speeding up workflows and one of the negative statements that medical imaging AI could replace my job within 3 to 5 years. Now, of all the negative statements, that was the one that was disagreed with by far the most. In other words, people are not worried. People in the profession are not worried about having their jobs replaced. And that is a nice kind of counter result to the one on speeding up workflows, perhaps.
And again, this is, as an experienced radiographer myself, this is the result I would expect from my peers, because every decade, new technologies come along, well, faster than that. And there's a little bit of unrest at the time, thinking, will the arrival of MRI mean the death of CT? And will new gadgets on ultrasound mean that MRI is no longer needed? And so on. But what we actually find is that, will new technologies actually mean that I'm no longer needed and so I'm unemployed? But what we find over the years is that with every new technology, things shuffle around a bit and adjustments are made, but there's actually room for everyone and everything. So we will work, hopefully, harmoniously alongside artificial intelligence, and it'll complement our work rather than take our work from us. And so the fact that most people don't feel their jobs are threatened is pleasing to see. And I think that's realistic as well. The other thing to think about is that as the decades go by, healthcare gets more and more complex. We are diagnosing and treating more and more complex diseases and combinations. Patients are living longer with many comorbidities. And so there's enough work to go around for everyone. In fact, as I've already said, there's too much work to go around for everyone. And artificial intelligence will hopefully speed things up and increase accuracy. But it's not going to mean there's a load of healthcare workers suddenly signing on because they're no longer needed.
Okay, so look, one of those three really, really key results on the positive statements was about more accurate diagnoses. Now, could you speak to that a little bit on the basis of your experience?
I think it goes back, my experience is particularly focused on ultrasound, and I think this relates to the fact that when you're a sonographer, it's not just a question of getting the best images or doing the best technical scan. In fact, that's the easy bit. The hard bit is interpreting your images and then analysing them and coming up with a reasonable diagnosis based not only on your images and the exam you've just done, but also on what the patient has just told you, how they look, what the referrer has told you, and also what that patient's previous imaging history shows as well. So you have to take all this information, synthesize it, and then come up with a reasonable diagnosis. And obviously our diagnoses are based on good education, very robust education and training programs, but also on our experiences as sonographers. And the more you see, the better you'll be at diagnosing. And so there is a big area of human error there, or potentially human error, or human ignorance of not being able to recognise certain appearances. Yes, we're trained to suspect something that's a tumour, or whether it's a blood clot or whatever, but there's always going to be errors. And I would hope that with artificial intelligence, it will narrow down that margin for error. I don't think it'll remove it completely, but it will hopefully help us to make more accurate diagnoses more frequently. That's what I'm hoping it'll do by helping us interpret our images.
Now, ultrasound is a bit unusual in this respect, right? Because normally with medical imaging, what you get is a static image, like an X-ray or an MRI, and then the radiologist has a static image upon which he or she can make a diagnosis. Now, ultrasound is more kind of sweeping thing, isn't it? Where you in real time get an impression of an organ. Now, does that mean that in ultrasound you come to a diagnosis in real time, or what's the difference there exactly?
It is a really important point, because that's the thing. Only the person who does the scan sees that full real-time examination that unfolds before their eyes on the screen. And they have to be quick thinking to process all that information and come up with the most likely diagnosis. Now, you can save snapshots that are representative of your examination. And in fact, we must. It's a requirement. But only you see the whole scan in real time. And so, yes, you do have to think on your feet, and you also have to be prepared to form a diagnosis. But then in the next few seconds or minutes of the exam, you then might have to discard that preliminary diagnosis because you've just seen something else that has made you realise that that's not possible. So you have to be able to think on your feet and change your mind.
Okay, good. Look, let's move on. I think as we go along, we're getting to the slightly more contentious areas here. Let's look at a couple of the negative statements that we tested for attitudes. One was, and this comes up a lot in the people in medical AI that I talk to, and I'm very interested in it. It's about legal liability for bad decisions. Now, this was an overall negative attitude, because people tended to agree that medical imaging AI has no clear framework for legal liability for bad decisions. Now, could you speak to that a little bit, Hazel?
Yeah, I can understand the concern. And I think that as the years go by, there will be test cases that will help to set the standards and which will help improve the framework for liability. But at the stage we're at now, my opinion is that if you have artificial intelligence built into your job as a radiologist or a radiographer, you must have training to be able to use it. You must be signed off in that training and proven to be competent before you're left unsupervised. And also it must be in your local protocols that you are using that software, and that's the pathway you go along. And I feel that at the moment, if that is happening in trusts with artificial intelligence, the staff are covered as they would be with any other situation through vicarious liability. So the trust, were you proven to have performed suboptimally in any way through artificial intelligence, and your local protocol says that's what you must be using, your trust will accept vicarious liability. And it's a bit like going back to when I said I used those automatic caliper placements on the babies at 12 weeks. If I had chosen not to use those calipers and to simply put the crosses where I thought they should go, and there was some error, the problem would be that I wasn't following my protocols. But in other words, I'm trying to say that if you follow your local schemes of work in your trust and your local protocols, you will be protected in the event of an error or a discrepancy. And that's another thing. It's worth pointing out that there's an awful lot of uncertainty in healthcare, which understandably patients find very hard to handle. They like certainty. They want a concrete diagnosis, and then they can be treated and get better. Well, unfortunately, lots of elements of healthcare are not like that. And you can have two different specialists who will come up with two different diagnoses based on the same set of images. And that is a discrepancy, not necessarily an error. So I hope I've made it clear, but I think if you adhere to your schemes of work, which include using AI, and you've used that AI correctly because you've been trained properly, I feel you won't be thrown under the bus. You'll be protected.
We could very well have the situation. We may already, in many cases, be in the kind of situation where we have AI systems which perform diagnoses, for example, more accurately than human experts on average. But those systems aren't being used because people are confused about legal liability. Like a software developer does not want to be legally liable for bad clinical decisions. I think it's a really important block to deployment. And I'm not sure that debate is really being had clearly enough at the moment. I don't know.
Right. So from your angle, you're finding that healthcare environments are reluctant to take up AI because of this lack of understanding and precedence within the legal world. So, yes, that's a very interesting angle.
Yeah, I think it's really the developers.
Before.
Developers don't want to be legally liable, so they're developing systems which are not giving diagnoses; they're giving suggestions, even though their diagnoses might be better. That's the kind of paradox. It's very interesting, I think.
Well, I think that's where things could work in harmony, because if their software gives suggestions or probability, that would help, although you don't want to blinker the healthcare professional, but that would help the healthcare professional come down on one side or the other, because often we're quite on the fence and torn between two different diagnoses. So I think given some kind of probability, there again, if that software is able to do that on the images in front of it. And then it's up to us as humans to put that probability together with the patient's age, with their clinical history, and all those human factors. Yeah, very, very murky area, very difficult. But I would be confident using AI in my work if I'd undergone the training. And I would assume that my trust has already bought that software because it's been tried and tested elsewhere. But yes, it's still in its infancy, isn't it?
Okay, all right. Let's move on to attitudes to imaging AI by previous use. Now, here I think we saw a pretty convincing picture that those people who had previously used medical imaging AI tended to have a more positive attitude towards it. Does that surprise you at all?
No, it doesn't actually, and it's lovely to see, because again, once you become familiar with something, if you do feel a little bit uneasy about it, and again, there's a lot of myth busting, I think, that needs to go on around artificial intelligence, because the moment you mention AI, the first thing people think about is robots and not having that human touch. And all our patients want the human touch. They want personalised healthcare. And is AI going to take all that away? But the very fact that everyone in the survey who had been involved with AI already are less anxious about it shows that it's predominantly about fear of the unknown, and that they're more confident and comfortable when they have had experience of it. Yes.
Okay, all right. Well, let's now move on to attitudes to imaging AI by age group. Now, here we saw a very nice result because positive attitudes increased with younger age. In other words, younger people were more enthusiastic about medical imaging AI, and likewise, negative attitudes increased with increasing age. In other words, this is the converse result. Could you speak to so? And this is quite a pronounced result. If you compare the younger and the older age groups, we see quite a profound difference here.
This is absolutely my favourite set of results from your survey. I think it's great. I think it's very black and white. And you look at the 20-somethings who responded to your survey, and they are very happy to take AI in their stride. And it looks like it pretty much holds no terrors for them. And that's because it's painting with a very broad brush here, but they are already tech lovers. They've been brought up with it far more than people like me. And you look at the other end of your graph in the people at the people in their late 50s and 60 and older, and they are the polar opposite. They are more concerned, more worried, probably watch too many science fiction films, and they have a lot of anxiety around the introduction of AI in their work. And and then everyone in the middle are kind of somewhere in between. They're in that grey zone. But yes, I love the stark difference between the 20-somethings and 60-somethings. And yes, it is to be expected. And again, it's just about having that confidence, being shown how to use it, what it can do. Importantly as well, I think, particularly in healthcare, what it can't do. And maybe that's at the crux of some of this discussion. We need a clear understanding as a group of professionals as to what artificial imaging intelligence can't do. And then perhaps everyone will relax about it a bit more. But yes, the 20-somethings would leave people like me absolutely standing. Yeah.
And then there's also the attitudes by sex as well. Now, I didn't really have special expectations on this. I mean, it's certainly true, and this is a very big bias, that men tend to be more represented in technology professions and also technology courses, like degree courses as well. So one might have expected more positive attitudes to medical AI on the part of men as compared to women. Now, we did see a result which was like that, although it wasn't really very strong. I mean, does that fit with your experience? What do you think about that?
Yeah, it does fit. And I'm not surprised there's a slight bias of men feeling more positive towards artificial intelligence. And again, I'll probably get roasted for saying this, but I think it's because of the way their brains are hardwired. They are generally, they enjoy their gadgets more than women, and they're more tech-minded. And as you say, they represent a larger proportion of the tech workforce. But equally, I'm not surprised that the bias is subtle, because again, we're talking in this survey predominantly about radiologists and radiographers, and I think women radiologists and radiographers come into the profession, yes, because they want to care and make a difference to patients, but also because they have that scientific mind. They are interested in physics and radiation and magnetic resonance and ultrasound. And so I think they have that kind of brain too. And that's why I think there's no stark difference. But as I say, I'll probably be hung, drawn and quartered by equality groups. But yes, there's a subtle bias with men feeling more positive to AI, but the women are not far behind in this group.
Exactly.
Yeah.
Okay. All right. Well, why don't we talk about medical AI more generally? What do you think are the other risks with medical AI?
Well, I think one risk, and this is my opinion only, of course, is potentially patients' expectations. I think one thing we have to contend with in healthcare in general is patients' very, very high expectations. I've already said that they find uncertainty difficult, many of them. They feel there's no room for mistakes, and they feel everything should be treated and cured. And of course, that's what we strive to do. But for various reasons beyond our control, we can't always meet those standards. And I worry that with the introduction of more and more artificial intelligence, patients will feel that there's even less wiggle room for any kind of error. And they will assume that everything is going to be got right first time. And when that doesn't happen, I worry that can cause even more problems for healthcare professionals. So possibly patient expectations might be too high with medical AI. I think one thing to possibly mitigate it is to make sure that patients are involved in medical AI research at every step of the way. I really do feel they need their voice, they need to have their say, and they need to take steps to understand it better as the research develops and
Well, that sounds like a
evolves.
really valuable follow-up study that we could look at, perhaps. So have you had conversations with patients about medical imaging AI, about the use of those techniques?
No, I can't say I have, to be honest, because I don't feel I have a large experience of AI within
Yeah.
my work. And why I stated that a few seconds ago was simply through my experience of patients using the healthcare system over the last 3 decades or so. So yes, I think with any medical breakthrough and anything to enhance our work, there is always that expectation that
Yeah.
we'll get everything right now. Then, so yes, it's just the general expectations.
Okay, now AI has a particularly interesting relationship to ultrasound in a way, and I'm talking about the home use of ultrasound. Now, at the moment, we have, and I'd love to just spend a minute exploring this with you. And at the moment, we have the possibility that the ultrasound could be used by people who have a minimum of training at home. And the reason for that is that AI systems can be used to help with probe placement, and then they can also be used to signal to the home user when a decent image has been acquired, and then potentially to use that image for diagnoses. Now, so, I mean, I know that some companies are very keen on this idea of, for the very first time, having ultrasound as the first imaging modality out there in the home, used in the same way that people use wearables and blood pressure monitors. Now, what do you think about that, Hazel?
How long have you got?
1 minute.
I have reservations. That's not long enough. No, I have reservations. I have very big reservations. In the right hands, this could be very helpful, particularly for patients who are stuck at home because of immobility issues and who have carers go in, perhaps. If those images could be fed back to professionals for interpretation and analysis. My concerns lie in the fact that at the moment ultrasound is very much unregulated. Anyone can buy an ultrasound unit and use for themselves. They're quite cheap. They start off at about £1,700 and go up to around about £75,000-80,000 with everything in between. And I just worry that too many people might buy these machines and look at themselves at home and then imagine all sorts of things and refer themselves into the NHS and add to that tsunami that I was talking about earlier. So I worry that it'll cause anxiety, and I also worry that some of these patients might somehow give themselves false reassurance and not present when they should present. So I have a big concern about ultrasound, home use of ultrasound. Yes, it scares the life out of
So it
me.
scares you at the moment, but could you imagine maybe in 5 years' time it being used effectively, safely, and responsibly by home users?
Time will tell. I think with the right software development and with the right regulation, I think there could be a place for it. It's hard to imagine at the moment, but then there's lots of things that have happened that I couldn't have imagined 5 or 10 or 20 years ago. So I think so long as there's the right legislation and regulation around the practice, and that the research is done carefully to monitor the outcome of this practice, then there could be a place for it. I would be very interested to see how that develops, and I will look to people like you to keep me informed, Felix.
Thank you, Hazel. Well, look, it's been an absolute pleasure speaking with you, and so thank you for coming on. It's much appreciated.
Well, thank you very much for inviting me. It's been a pleasure for me
talk to you
too.
again. Bye-bye. Thank you for listening. I'm Felix Beacher. Ping me on LinkedIn for more information on Omdia's services in healthcare technology. See you next time.